Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel. You can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Rashmi. To give you a brief introduction about Dr. Rashmi, Dr. Rashmi is a master's of periodontics and a master's in hospital administration. She did her BDS from M.R. Ambedkar Dental College and Hospital, Bangalore, and she did her post-graduation in periodontology from the Oxford Dental College and Hospital, Bangalore. She has more than 12 years of experience in teaching, and she's currently a guide for undergraduates and postgraduates associated with the Department of Periodontology, Krishnadevaraya College of Dental Sciences, Bangalore. She has several publications in national and international journals and is on the editorial board of several journals. She has several presentations to her credit on national and international conferences and has also won prizes for her presentations. She is currently a consultant periodontist and has guided and performed several implant and laser-related surgeries. Dr. Rashmi, welcome to Talk with Your Dentist conversation.
Thank you, Dr. Rekha. Thank you for the wonderful introduction. That's very nice of you.
Yes. So, Dr. Rashmi, when we talk of periodontics,
Yes.
or in layman's terms, what we call as gums. So, periodontics is something that is associated with our gums. So, what exactly do we cover under this particular topic?
Okay, so most people are generally not aware of what a periodontist is. Okay, so peri and odont. That means peri means around, odont means around the tooth. So basically, the tissues around the tooth is what periodontia or periodontology deals with in general. Okay, so what layman terms, if you have to say, it is nothing but the gums, which we call it gingiva. Okay, in our professional terminology, there are other tissues associated with it also, which generally I'll not get much into detail. It's basically some of the connective tissue with the bone, which supports the tooth as a total compound unit. Basically, it grounds your tooth. In a layman's term, if you say, it is a foundation for that building that you're living in. Okay, that is what we deal with, and it is the field which gets least amount of recognition, because nobody is aware of it till their tooth is actually out of their mouth. And it's very sorry to say we can't do much at that stage. Okay, yes. Thank you.
Yeah, so basically, this is the field in dentistry that deals with the health of the gums.
Yes.
So when we say the health of the gums, yes. I think I was just wondering if you can throw some light about the gums being an indicator of our general health. Is it possible? Is it possible to detect any general health condition by looking at the health of the gums?
Oh yes, definitely. We have come in leaps and bounds from a lot of years when it comes to how teeth or gums are affected by the general health of an individual. Although still sorry to say, the awareness about it is, I would say, minimal actually as such. So now, as a lay person, when a person looks at his teeth and brushes his teeth, the only condition which brings him or her to a dentist is bleeding gums. Okay. Or at the most, if you look into the mirror a little more deeply, you'll see reddening of the gums, which I don't think many will notice, but that is the next symptom that gets them to the dentist. And the last, but the worst, that is the tooth shaking and then it is coming out of the mouth. Okay, these are the symptoms that get a person to the dentist. These are the three common. Pain, sorry to say, we don't have not much pain when it comes to periodontium. Unlike when it is an endodontic problem where they have to go for a root canal treatment, it is highly excruciating. Here it is more like a dull, gnawing kind of a pain, which our pain thresholds are generally higher as Indians. So I think we come to the dentist in the end. Okay, so that's what gets them. Now, getting into the medicine part as such. See, generally, in 1400s and 1600s, most of the scientists came up with this some infection theory called focal infection theory. According to them, some infection in the mouth can cause something in the general health. So what I would say, there are few generally dealt with diseases that show some symptoms in your mouth. Okay, the first and foremost among them is the diabetes. Okay, or sugar disease, or whatever people call that. Now, see, many patients that come on our dental chair, we tend to diagnose them as diabetics based on those symptoms that we see on the dental chair. We would have told even our students also, what you see is, when a person is a diabetic, before that, talking about diabetes, we know there are two types in general. Okay, one with the younger individuals, which is very rare, but the more commoner one is seen in a slightly older age group and in slightly obese individuals. And as we all know, India is our diabetes capital. So it is all the more important to see your mouth, or one of your dentists should see the mouth. So when a patient comes who's not aware that he's a diabetic and he's sitting on the chair, commonly the common symptom that they come up with is multiple pus discharge, or abscesses that we call it as. Pus discharge is seen in multiple places. Patient also has something called as halitosis or bad breath. Okay, that they may be aware of. See, there are two symptoms which the patient can make out and which as a dentist you can make out. If the patient can make out, well and good, it gets them to us. Okay, so these are the two common symptoms that we see when the patient comes to us as a diabetic. He's a diabetic, he or she is a diabetic. So the minute you see multiple abscesses or pus discharges in the mouth associated with that very bad breath, or halitosis as it's commonly called, immediately we send the patient for a basic screening test. Okay, something like your random blood sugar. Definitely that will show a little variation, but even that has some pros and cons also. It may or may not show. At least we can indicate it. Other than that, the less common symptoms will be something like burning mouth, or any oral wounds which are not healing for long periods of time. Okay, these are the less common symptoms. The commonest symptom that patient comes to us is with several pus discharges in the mouth and teeth becoming shaky. Mobility is the secondary symptom that they come with. That is talking about diabetes. Okay, that is one condition we can definitely diagnose. One more thing, this is one of the endocrine, means that is your hormonal disorders, that is diabetes. The other hormonal condition is more common in women. Okay, women, whether they are in the menstrual gap of period, or they are pregnant women more commonly. Okay, that we have to deal with. Pregnant women more commonly have more redness in their mouth. Why do you see more redder gums? Till then, there wouldn't be any problem. Of course, for all of that, you need some deposits around your teeth, right? Yes. You have to maintain your oral health very well during that period. So we have to, tell those patients that when you get pregnant, please make sure that you get your teeth scaled. That way only in the second trimester.
So I think although there is some amount of hormonal changes that does cause some kind of a gum infection, I think proper and meticulous oral hygiene and regular visits to the dentist for a checkup and some scaling and cleaning procedures, I think that is more important in keeping a lot of gum conditions under check.
Yeah, you're absolutely right. See, unless the teeth are not clean, you won't land up with any of these conditions. The only thing is you be more stringent with your oral hygiene maintenance during these phases. That's what we insist upon. And commonly pregnant women, the problem is you can't do treatment at all periods. That is, certain hormonal levels, that is common hormones called progesterone and estrogen, the levels shoot up like around 3 to 4 times, up to 8 times also. So this is what causes excessive swelling, redness, bleeding, spontaneous bleeding. Just like that, patient will tell, till now doctor, I didn't have any problem. Suddenly I am feeling that there is a lot of bleeding in my gums. Yeah, that's what they say. So, but we can't treat them during that phase other than the basic scaling. No surgeries can be done. It's only between the 3rd month of pregnancy to the 7th month we can do something. That is the second trimester is the time dentist can do any treatment, and you shouldn't be doing anything because the first 3 months are very crucial periods of organogenesis, right? And the last 3 months are very difficult because the bodily changes do not cooperate with the patient sitting on a dental chair. So that is a thing. So commonly you see, even slight deposits, the body reacts very badly. See how for a pregnant woman, the fetus has to be protected by immune system. That immune system will react to any foreign body, which can be the deposits around your teeth. So this is what happens in a pregnant woman. When it comes to women in the menopausal age group, common complaint that we come across is burning mouth and very sensitive gums. Okay, so very sensitive gums and altered taste sensation. Okay, so these are very common problems. So all you can do is a palliative treatment as a dentist. That is, you just give them vitamin supplements or whatever it is. Okay, so our body has a way of reacting at various phases of life. That is when you talk of the hormonal problem. Now coming to the more serious issues that we have to go to. That is, if the patient has commonly what is called as like, what do we say this?
Some conditions
Let's say the blood cancer, that is in layman's term blood cancer, which we call as leukemias. Okay, in when a patient has blood cancer or leukemias, how does the patient present to us? That is very, very important, and we keep telling our students also that you screen them. You see excessive swelling, okay, of the gums in all areas. That is all areas you see that, right? That is one thing. Then other than that, you also see spontaneous bleeding here. And because the body's defense system is very low, frequent ulceration and in the form of pain. They can tell you a lot of ulcers are there and I have a lot of pain. What to do, doctor? Okay, so these are the key indicators that the patient has some form of leukemia or the other. Bleeding, ulceration, and of course it is associated with even mobility also, as all the symptoms of periodontal diseases are commonly. Okay, next coming to anemia, which is commoner, okay, in our country. Yeah.
Yes.
So when you're,
and considering it goes more or less undetected most of the time, because
yes,
I think considering something like a leukemia or a breast cancer is something probably which would get diagnosed. But I
yes,
think something like anemia, which is more common and goes undiagnosed, I think
yes,
how it would probably present itself would be more important.
yes. See what you can see on your routine scaling when you're doing for these patients, they bleed excessively. They bleed. And if we take up these patients for our periodontal surgery or the gum surgery, the bleeding is very hard to control. So at least you need to have a hemoglobin level of at least 8 to 9, a minimum of that before you undertake any treatment in these patients. Otherwise, they will show these signs of excessive bleeding. Immediately, you send for a hematological picture. See, otherwise also commonly before we undertake any surgery, we send the patient for a blood picture. That is a really nice thing. Okay,
But,
so
but definitely, if a patient notices, heavy bleeding or excessive bleeding, and probably especially in women, because anemia would probably be more common in women. So I think
yes,
women have to take note of this fact that if there is
yes,
kind of excessive bleeding, which is like a little unusual, then it's better
yes.
to see a dentist and then get a blood check done to rule out the possibility of anemia.
Exactly. We have to rule out that when you see excessive bleeding, these are all the things that should come into our mind. Of course, there is also one more thing which I missed out. That is any medication that you may be taking, like your oral contraceptives also induce some amount of bleeding. And women in that phase of their month also, they exhibit excessive bleeding. Okay, these are the common things. You have to rule them out. For that reason, you need to know them. And of course, then other than that, you have the less common syndromes where you see teeth are lost by the age of 3 years, and all the that is like not so common.
Yes, yes,
Yeah.
yes. So, Dr. Rashmi, I think that was a very useful talk. I mean, in trying to tell patients, not to neglect bleeding gums. Although the most common cause for a bleeding gums could be the plaque or the tartar deposit, unremoved tartar that remains on the teeth, damages the
Yes.
gums, causes bleeding. Any
Yes.
excessive bleeding is something that patients have to take note of, or for that matter, even any bleeding gums is something that patients have to take it a little seriously and visit their dentist, like you said, because gum infection is generally a very slowly progressing one and it is not as painful. So
Yes,
patients
that's right.
push it and postpone it further. So it
That's
becomes
right.
really important that they visit their dentist regularly, say once in 4 months to 6 months, get their checkup done, and if some amount of cleaning and all has to be done, they get it done, and ensure that the gums remain healthy. Because I think end of the day, the gums and the associated bones are the foundations for your teeth. So if they are not strong, no amount of any treatment would serve any purpose at all.
Exactly. You're very right that way, Dr. Rekha.
Thank
That
you.
is there.
So, Dr. Rashmi, thank you so much for joining me today, and I hope I can bring you back on this Truth Thought conversation to discuss on another interesting topic on our gum conditions.
On our gum conditions.
No, general population, like people, general people, there about there.
I didn't get your question clearly, Dr. Rekha, as in?
No, I was saying thank you so much for joining me today, and I hope I can get you back for another talk, to discuss with our patients and tell them about another topic on their gum conditions.
Oh, sorry. I got it now. But before concluding, I would like to say one point, Dr. Rekha. What I'm noticing in this present crisis that we are in, the pandemic crisis of COVID-19, what I'm noticing is several of our, colleagues or our professionals, in spite of knowing it, are keeping their clinics open, and we act as focal centers to, spread the diseases. So please, you are educated, educate the public. That is your, basic civic responsibility. Please do that, because it's really very necessary now in the third phase, that is the community spread phase of COVID-19. Please do that. It's very, very urgent.
Yes.
Yeah.
Yes.
Thank you.
Thank you. Thank you so much.
Okay. Bye.
Bye. That was Dr. Rashmi, who did talk to us about how your general health condition can be detected by looking at the health of your gums. And I hope that talk was helpful. And if you have any queries, please do leave your questions below in the comment section and we will get back to you. So until next time that I come back with another dentist with another topic about your oral and dental health, please keep smiling, stay safe, and be happy. Thank you.